Assalamualaikum. Welcome back. In this video, I have discussed important 50 medical surgical MCQs. These MCQs are helpful for all nursing related exam preparation. So, if you are new in my channel, then don't forget to like, share and subscribe. So, without wasting time, let's get started. What is the normal range of serum potassium in the body? Correct answer is option A, 3.5 to 5. The best method to prevent the spread of infection in a hospital is. Correct answer is option C, proper hand hygiene. Which electrolyte imbalance is commonly associated with severe vomiting? Correct answer is option B, hypokalemia. What is the primary sign of hypovolemic shock? Correct answer is option B, hypotension. The first nursing intervention for a patient experiencing a seizure is. Correct answer is option C, protect the patient from injury. Which condition is characterized by a butterfly rash on the face? Correct answer is option B, lupus erythematosus. A major complication of hypertension is. Correct answer is option B, stroke. What is the common cause of peptic ulcer disease? Correct answer is option B, H. pylori infection. A patient with COPD often exhibits which characteristic? Correct answer is option B, prolonged expiratory phase. What is the hallmark symptom of appendicitis? Correct answer is option B, right lower quadrant pain. The most reliable indicator of fluid volume status is. Correct answer is option B, weight changes. Which of the following is a classic symptom of myocardial infarction? Correct answer is option A, sudden severe chest pain. The priority nursing intervention for a patient with acute pancreatitis is. Correct answer is option B, pain management. Which blood test is most indicative of renal function? Correct answer is option B, blood urea nitrogen. What is the normal range of arterial blood pH? Correct answer is option A, 7.35 to 7.45. Which condition is associated with jaundice? Correct answer is option B, liver dysfunction. What is the best position for a patient with dyspnea? Correct answer is option C, semi-fowlers. The primary purpose of chest physiotherapy is. Correct answer is option B, remove secretions from the lungs. Which of the following is an early symptom of hypoxia? Correct answer is option C, restlessness. A patient on diuretic should be monitored for. Correct answer is option B, hypokalemia. The primary symptom of cataracts is. Correct answer is option B, cloudy or blurred vision. A pulse oximetry reading of 90% indicates. Correct answer is option B, mild hypoxemia. What is the first line of treatment for anaphylactic shock? Correct answer is option C, epinephrine. Which condition requires immediate airway management? Correct answer is option B, epiglottis. A characteristic symptom of Parkinson's disease is. Correct answer is option B, resting tremor. What is the recommended diet for a patient with renal failure? Correct answer is option B, low protein, low sodium. The therapeutic INR range for patients on warfarin is. Correct answer is option B, 2 to 3. A common complication of diabetes is. Correct answer is option B, diabetic neuropathy. Which sign indicates a deep vein thrombosis? Correct answer is option B, positive Hoffman sign. The primary goal of nursing care for a patient with a stroke is to. Correct answer is option C, minimize neurological damage. What is a common complication of immobility? Correct answer is option B, deep vein thrombosis. A patient with congestive heart failure is most likely to exhibit. Correct answer is option B, peripheral edema. What is the primary cause of type 1 diabetes mellitus? Correct answer is option B, autoimmune destruction of beta cells. What is the most common site for a pressure ulcer? Correct answer is option B, sacrum. What is the priority nursing intervention for a patient experiencing chest pain? Correct answer is option D, administer oxygen. Which electrolyte imbalance is associated with tetany and muscle cramps? Correct answer is option B, hypocalcemia. What is the first step in managing a patient with suspected airway obstruction? Correct answer is option C, open the airway. The most common cause of hospital-acquired infections is. Correct answer is option B, improper hand hygiene. A symptom of Cushing syndrome is. Correct answer is option B, moon face. The hallmark symptom of chronic obstructive pulmonary disease is. Correct answer is option A, persistent cough with septum. Which diagnostic test is used to confirm tuberculosis? Correct answer is option B, septum culture. What is the primary nursing consideration for a patient undergoing dialysis? Correct answer is option B, monitor electrolyte levels. Which symptom is common in hypothyroidism? Correct answer is option B, weight gain. What is the first nursing action for a burn patient? Correct answer is option D. Remove clothing from the burn area. Which lab test is most critical to monitor in a patient receiving anticoagulant therapy? Correct answer is option B. Prothrombin time. A major complication of a gastric ulcer is. Correct answer is option A. Perforation. Which condition is an early sign of increased intracranial pressure? Correct answer is option B. Restlessness and confusion. Which medication is commonly used to treat severe asthma attacks? Correct answer is option B. Albuterol. What is the most common symptom of anemia? Correct answer is option C. Fatigue. What is the main goal in the management of diabetes mellitus? Correct answer is option C. Maintain normal blood glucose levels.